Knock, knock. Hi, it's me, Irene. I said I was coming back with my Trach supplies. Once I assessed you, I know we needed to have you get suction. Okay? So, what I'm going to do is close the door, close the curtains. I'm going to wash my hands. Okay? Sanitize my hands. Okay, I'm going to put my gloves on. Okay. So, how you doing, Miss Maggie? All right, good. Okay. All right, so let's see who you are. Even though I know, gotta check anyway, Miss Maggie. All right, can you give me your name and date of birth? All right. Okay, I'm just checking your wristband. What did you say? All right, thank you, Miss Maggie. I'm gonna check the computer, verify everything. Everything's okay. Okay. So when I was in here about 5 or 10 minutes ago, I told you I would be back to suction you because I did a respiratory assessment on you by listening to your lungs. And when I listened to your lungs, I heard some noise like bronchitis, a little bit of some crackles. And then more importantly, you told me you felt there was some secretions in there that you could not bring up and that you really should be suction. And then also I assessed your O2 level, and your O2 level, you were just a little bit lower than you normally are. So it'd be a good thing to suction you to get all those secretions out and help you breathe a little better. So do you have any questions on the procedure that we're going to be doing? Okay, good. Now, are you in any pain or anything like that? Because we do have pain medication. No. Okay, no pain medication. So at any time we're doing this procedure, just let me know if you're having any difficulties. Okay? So the first thing I'm going to do is I'm going to raise the bed. Okay? And to a working height. I'm going to put down the side rail. Okay? And then I'm going to put the head of the bed up to put you in a semi-Fowler's position to make it easier for suctioning and for you for breathing. And then I'm going to turn on the wall suctioning unit. I'm going to put it at 150 because that's what it is for adults. And then I'm going to see whether it's working by putting my hand right here on the suction piece. Okay? All right, so we have that taken care of. And the next thing I have is my resuscitation bag, my amble bag, to hyperventilate you in between suction you. Okay? So we're all set and ready to go. So what I'm going to do is take my gloves off, throw them in the trash, and then I'm going to sanitize my hands. Okay? And then what I'm going to do is put a cloth over you here. Okay? A little mat there to catch anything if anything decides to want to come out. Okay. So with that being done, I'm going to move my camera, since it's just me, over to make sure my professor knows that I'm trying to do everything, at least by the book here. The most important thing is that taking out the gloves and everything like that. All right, so what I'm going to do is open up my catheter kit here and put this down here like this. Okay, open it up, take out the container here, put it onto the side here, and open the other side here. Okay, take some sterile water, put it in to the catheter container. Okay, I'm gonna put my gloves on, my mask on. There you go. Put my goggles on. Goggle. Okay. And then the most important thing, to make sure I keep a sterile technique with these gloves and putting these gloves on. Okay. Let's see here. Okay. Okay. Gloves on. Got the other glove. Okay. All right. Okay. The next thing I want to do is I have this here catheter in here, but what I want to do first though is take my camera and put it over here on the bed since it's just me, so you can see how I'm doing with Miss Maggie. Okay, so I got this here, the catheter. So what I'm going to do is take the part that goes into the wall suctioning, put it in my non-dominant hand, and take the other part and put it in my dominant hand, and then throw the bag away in the trash. Just drop it in the trash. Okay, here it is. Okay. And then what I'm going to do is non-dominant hand, put it in here. Okay. All right, there it is. It's in there. I'm going to test it, see whether it's working. Okay, it's working. Now, this part here, which goes into the mouth, should only go in as much as possible. This is up to 6 right here. So depending on anywhere, maybe up to 5, maybe up to 6. It just depends. But you don't want to put it all the way down in the throat. I'm going to stick this in some water, normal saline that I pulled out, or sterile water, depending on your facility's policy, and then just get it to go through. Okay, we'll do that. Okay, do that. All right. What I'm going to do with my non-dominant hand is hypervent my patient anywhere from 3 to 6 times to make sure while I'm suctioning her that she has enough air. And then I've done that. But once I do this, I'm only allowed to do this here anywhere from 10, put it in her suctioning, from 10 to 15 seconds. And then when I'm bringing it out and going around, I'll just bring it out. I'll be like, put my hand like this here, and then going around and then bringing it out. Okay, not really pushing on this. Okay, so I'll do that. Okay. All right, she's out. Then I'm going to hyperventilate her again to make sure she's okay, anywhere from 3 to 6 times. Okay, so once I've hyperventilated her, I'm going to ask her to cough up any secretions that she has and to see whether we need to do this again. Okay, so she's coughing and she felt as though the secretions that she's had in there, they're all up, and then everything came into me suction her. So she feels a lot better. So I don't need to resuction her. But if I had to resuction her again, I can only do that 1 to 3 times, like I said before. And I have to wait in between suctionings from 30 seconds to a minute to do that in between suctioning. Okay? So since I've just hyperventilated her, and then I've without that. So what I'm going to do is put this here in the normal saline to clean it out just a little bit more. So I'm going to go into her throat to make sure she doesn't have anything in there. Okay? Okay. All right. So I put it in her throat. She doesn't have anything in there. Everything is good. Okay. So we're finished suctioning and everything like that. So what I want to do is offer her oral hygiene. Okay, so I'm just gonna take this here and just hold on to it into my other hand and do oral hygiene with my other hand, with my dominant hand. This don't want to be dirty, and this hand is dirty because I don't want to take my gloves off doing oral hygiene. So we've done the oral hygiene. The hygiene's okay. Now what I'm going to do is roll this up and put it in to the trash. Okay? Because I've done the oral hygiene and everything. Okay? So, I'm going to put the bed down to a nice position where she was before. Put the bed rail up. Put her back into a nice position out of the semi-phallus positions. Okay? And then what I'm going to do is I'm going to sanitize my hands, okay? Simply because of the fact, even though I'm just taking my gloves off, I still like to sanitize my hands. And then I'm going to reassess her, okay? And to do that, I'm going to reassess her lungs, do a respiratory check on her. And to do that, what I need to do is make sure, check her lungs, make sure her breathing's okay, make sure I check her rate. I also need to check her O2 and make sure she's okay. And then also the most important thing is ask her, is she okay? And she says she's okay. All right, since I'm finished doing all that and she's okay and all, what I'm going to do is take my goggles off just in case something comes out a little bit later. And then I'm going to throw my mask and everything away and I'm finished, okay? And I will do my documentation. Thank you.